Mental health disorders affect millions of people worldwide, but while conditions like depression, anxiety, and schizophrenia are widely recognized, some disorders are so rare and disturbing that they remain largely unknown to the public. These disorders challenge our understanding of reality, identity, and perception, often leading those affected to experience terrifying hallucinations, uncontrollable urges, or extreme delusions. In this video, we will see 6 of the most disturbing and rarest mental disorders ever recorded. Cotard's delusion, the walking corpse syndrome. Cotard's delusion, also known as walking corpse syndrome, is one of the most bizarre and unsettling mental disorders in history. Those who suffer from it firmly believe that they are dead, do not exist, or have lost vital organs, blood, or even their soul. Some patients insist that their body is rotting, while others claim they have ceased to exist entirely. The disorder was first described in 1880 by French neurologist Jules Cotard, who studied a woman convinced that she had no brain, nerves, or intestines. She also believed she did not need to eat because she was already dead. Tragically, she later died from starvation, a fate that has been reported in multiple cases of Cotard's delusion. Neurologists believe the disorder is linked to dysfunction in the brain's temporal and parietal lobes, which control self-awareness and perception. In extreme cases, individuals may wander into graveyards, believing they belong there, or attempt self-mutilation to prove their body is decaying. Treatment usually involves antipsychotic medications and electroconvulsive therapy, but many cases remain resistant to treatment, leaving the sufferers trapped in a nightmarish existence where they feel they are already dead. Alien hand syndrome, when your hand has a mind of its own. Alien hand syndrome is a rare neurological disorder in which a person's hand appears to act independently, often performing complex movements without the person's control or awareness. The affected hand might grab objects, remove clothing, hit the person's own body, or even attempt to strangle the individual, completely against their will. This disorder is often linked to brain damage from strokes, brain tumors, or surgery on the corpus callosum, the bridge connecting the 2 brain hemispheres. Because the brain's hemispheres lose coordination, the affected hand behaves as though it has its own consciousness. One of the most disturbing aspects of alien hand syndrome is that the affected individual is fully aware of their row hand's actions, but completely powerless to control them. Some patients report feeling as if the hand belongs to an external force, a spirit, or even an alien entity. This eerie sensation can lead to extreme distress, paranoia, and, in some cases, severe injury or self-harm. There is currently no cure for alien hand syndrome, though treatment strategies like cognitive behavioral therapy and muscle-restricting techniques can help reduce episodes. However, for many sufferers, the terror of having an uncontrollable limb remains an everyday struggle. Capgras Delusion, the belief that loved ones are impostors. Capgras delusion is a psychotic disorder where individuals believe that someone close to them, a spouse, family member, or friend, has been replaced by an identical imposter. This terrifying disorder makes sufferers mistrust and even fear their loved ones, sometimes leading to violent confrontations. First described in 1923 by French psychiatrist Joseph Capgras, this condition is linked to damage in the brain's facial recognition system, causing a disconnect between emotional response and visual identification. As a result, the brain recognizes the person's face but does not associate them with familiarity, leading to the disturbing conclusion that they must be a fake. In extreme cases, patients may refuse to interact with their fake loved ones, or even believe that their home, pets, or workplace have been replaced with identical copies. Some individuals develop elaborate conspiracy theories, believing they are trapped in a simulation or targeted by an unknown force. Capgras dementia is frequently associated with schizophrenia, brain injuries, and neurodegenerative diseases like Alzheimer's. Treatment typically includes antipsychotic medications and therapy, but for those suffering from this delusion, the constant fear of impostors and deception can be a lifelong battle. Exploding head syndrome, the terrifying sound of non-existent explosions. Exploding head syndrome is a sleep disorder where individuals experience loud, explosive noises just as they are falling asleep or waking up. These sounds, often described as gunshots, screaming, fireworks, or a bomb exploding are completely imaginary but feel so real that sufferers wake up in terror. While exploding head syndrome is harmless in a physical sense, it causes severe sleep disruption, anxiety, and panic attacks. Some sufferers even report seeing bright flashes of light or feeling electrical jolts along with the auditory hallucinations. The experience is often so disturbing and disorienting that many individuals fear they are having a stroke or suffering from a supernatural event. Scientists believe exploding head syndrome occurs due to a neurological glitch in the brainstem when the brain transitions between wakefulness and sleep. The auditory and visual processing centers misfire, creating the illusion of a loud explosion. Despite being terrifying, the disorder is not physically harmful, though its psychological impact can be severe. There is no definitive cure, but relaxation techniques, avoiding caffeine before bed, and managing stress levels can help reduce episodes. However, for those who suffer from it regularly, the fear of hearing an explosion every time they fall asleep can make sleep itself a terrifying ordeal. Autophagia, the urge to eat your own flesh. Autophagia is an extremely disturbing and rare impulse control disorder where individuals feel an uncontrollable urge to eat their own body parts, often biting, chewing, or consuming their own flesh. In severe cases, sufferers have chewed off fingers, lips, or chunks of skin, sometimes without feeling pain. Autophagia is often linked to schizophrenia, obsessive-compulsive disorder, OCD, and severe self-harm tendencies. The exact cause is unclear, but some researchers believe it is due to neurological damage or chemical imbalances that affect impulse control. Some sufferers describe hearing voices compelling them to eat themselves, while others engage in self-cannibalism during episodes of extreme stress or dissociation. This disorder is considered one of the most extreme forms of self-mutilation, with no guaranteed treatment. Behavioral therapy and heavy doses of antipsychotic medications can sometimes suppress the urge, but many cases result in hospitalization due to the severity of self-inflicted injuries. Boanthropy, the delusion of being a cow. Boanthropy is a rare psychotic disorder where an individual believes they are a cow or an ox and begins acting like one, sometimes walking on all fours, grazing on grass, or making animal sounds. One of the most famous cases of boanthropy is found in the Bible, where King Nebuchadnezzar of Babylon was cursed to live as an animal for 7 years, eating grass like an ox. While this may have been a metaphor, modern psychiatry recognizes benevolence as a real mental disorder. This bizarre condition is often linked to schizophrenia, severe trauma, or hypnotic suggestion. The affected individuals fully believe they are animals, and may even prefer to live outdoors, rejecting human food. Treatment is extremely difficult, as patients often resist therapy, believing they are meant to be animals. However, antipsychotic medication and behavioral therapy have helped some regain their sense of reality. These rare and disturbing disorders challenge our understanding of the human mind. Whether through delusions of death, identity confusion, or uncontrollable impulses, they reveal the fragility of human perception and how easily the brain can turn against itself. Though rare, these disorders highlight the importance of mental health awareness and medical research, as many of them remain poorly understood and difficult to treat.